Welcome back to HealthCare Consumerism Radio. This is Doug Fields, CEO of the Institute for HealthCare Consumerism, along with my co-host, Brent Macy. This morning, we have on the program Dr. Miles Varn, who's Chief Medical Officer with PinnacleCare. It's a leading health advisory firm located in Baltimore, and would like to welcome you to the program, Doctor. Good to have you this morning.
Thank you, gentlemen. Thanks for having me.
Tell us a little bit about, what you do, what PinnacleCare does. You've been in, there's a lot of companies coming into this business that say they can help the consumers. I'm not saying they can't, but I thought it was distinct to note that how long you've been in this business. So tell us about, where you've come from and what you do today.
Yeah, sure. That's a great point. We've been in business for about 12 years now, and so we've really pioneered this concept. And it's important to understand that, from our perspective, it's all about the patient. And if you educate the patient and give them choices of higher-end providers, higher-end institutions, particularly for complex problems, they will make better decisions that lead to better outcomes, more reduction in costs by virtue of fewer complications, fewer readmissions, et cetera. So the way we work, we're a very personalized business. Each individual, has a unique problem from our perspective. We work independently and objectively. So we have relationships with a number of different premier institutions around the country and have identified and formed relationships with a number of different top-end providers, but we do so objectively. So we're not bound to any one institution or one provider. We always look at what's best for the patient and really help them overcome the barriers to defining the resources that will lead to a great outcome on their part.
Miles, do you go as far as actually helping them negotiate the cost of the treatment?
We don't do that as a business, although we do have partner companies who work with us to help our clients do that.
Okay.
Miles, what appears to be, you guys got a very good solution set, but what appears to be, serving as the catalyst for the need of your solutions in the market, in your opinion?
Well, I think we all know healthcare is becoming more complex, both from a technology perspective as well as just from an access perspective. Now you've got systems buying other systems so that we're, it's confusing even for the experts to sort out, who belongs to which system or which system they belong to that's now got a different name, or, the Cleveland Clinic's got his name all over the place. So, part of it's just complexity. Certainly part of it is access. You've got today and now about a 9,000 person deficit in terms of primary care physicians. Mm-hmm. That's only going to increase over time as we move forward with some of the reform. You've got more people accessing a system that's already overtaxed. So, access is going to be a problem. So I think it's pretty obvious that the complexity leads to the need for assistance in navigating and assistance in educating yourself as to where to go, who to see, and how to get there.
Yeah, and I think the other compelling driver is that employees and their families, the consumers, are being asked to be exactly that, a consumer. They've never really had to be consumers of healthcare and health decisions before. It's been an entitlement, but now they have an economic driver as well as a health driver behind that, correct?
Absolutely. I mean, more and more the cost is being shifted onto the consumer, and, as a result, what they get for their money, really is much more important today.
From an advisory standpoint and healthcare access, which we know is a major issue, to your point, does your firm advise patients to maybe use some telemedicine services for certain conditions, to use some of what are the emerging near-site, on-site health clinics. I mean, on-site would be a different dynamic if you're working with an employer. But are you advising them to better understand and maybe take the first step and use a telemedicine service for certain conditions?
I think for some of the less complicated problems, where convenience and value of time is most important, that absolutely. But you have to be careful, that you're getting the right advice and going somewhere that's qualified to diagnose you and that you give them the right information. But I think for more complex situations, oncology, heart valve replacement, joint replacement, that our approach has been to bring what we call virtual consultations to the patient. So expertise from elsewhere, but more in the way of having a top expert review the case, including images and specific questions and all the records, and then returning, an expert opinion that can be potentially administered on a local basis. I think that's really critical when you get into complex problems. But, we're going to see more of ancillary providers, including, internet-based and telephonic, that are going to be out there serving that vacuum of primary care, that is already here and only going to get worse.
Yeah, and I just see, the reason I ask that question, I see not only do I see the proliferation of that emerging on the marketplace, but I also see that a firm like yours is very important to helping even the employer make the right decision on which service to provide to their employees, let alone that consumer understanding for what conditions or what type of service they should use. Because there's, I think there's going to be, some solutions out there that might not be, a grade A, so to speak, that they need to be careful of.
Exactly.
Now, Miles, I think when you guys get engaged with a customer, what do you really see in the whole process from the time you get engaged with them all the way through where they make that healthcare decision with your expertise and help?
That's a great question. I think what would be most useful is, let me try to give you an example, a common one. Back pain is very common. And if you're the average...
Yeah, I have it right now. So.
We all do to some extent. So if you're the average consumer, and let's say you've gone as far as getting an MRI and there are abnormalities there. Well, for a lot of people, the first thing they do is go online.
Yeah.
But if you put, if you go onto Google and put back pain in, you get 500 million choices. 500 million. So if you narrow it down to back pain treatment, it gets better, but you still have 100 million choices.
Yeah.
And the first, 5 at the top are ads, and a lot of people don't know that. So, how do you sort out what's best for you? What's actually evidence-based, or what's actually, the right thing for your condition? Is it surgery? Is it non-surgery? If it's non-surgery, what are the approaches? If it's surgery, what are the approaches? So, what we do in terms of our expertise is, first and foremost, we educate the consumer about the choices. Mm-hmm. So, if in their situation the outcomes are equally the same, if in a surgical and non-surgical approach, then they need to be informed so that they at least hear both sides. And if they're not informed, they may not hear both sides. They go to a neurosurgeon or an orthopedic spine guy. He looks at their MRI and goes, well, there's an abnormality here. I do surgery. Let me fix it. But pain management, acupuncture, physical therapy may be equally effective, and our job is to connect them to people who can help them understand those choices so they make an educated decision.
Mm-hmm.
So from the whole process, if I look at, the one things that we're starting to see right now is a big emergence of healthcare exchanges, whether it be public or private. Do you guys Do you have a play in that? I mean, where I see the correlation is, the private exchange or the public exchange, you're going to be a consumer of healthcare regardless if you're ready or not. Are you guys looking at that as a vehicle to kind of be that trusted voice in helping people make better decisions around their healthcare?
Absolutely. We'd love to work with the exchanges as if nothing else, a value add to that decision-making process. Because, if you think about it, when you have complex legal problems, you generally get an attorney to help you. If you have complex estate problems, wills and so forth, you have an expert help you.
Yeah.
If you're buying a car, most people research it and bring in some sort of expertise. So I think, bringing objective expertise to complex decision-making is almost obvious, but no one's ever really done it in healthcare to the extent that we have.
Right. We got about a minute left, Miles. Kind of give us, what we like to do is kind of give us, a 30-second wrap-up of what is a clear takeaway you want our audience to understand about you.
Well, I think, for anyone with a complex healthcare decision, I would strongly encourage you to bring a partner in to work with you, an educated, connected partner, so that you, number one, know all the choices and make an informed decision, and not necessarily a quick decision, but a thoughtful, deliberate decision. And number two, I think from the business side, more and more corporations are beginning to realize that quality, and we've always focused purely on the consumer, but quality of care really leads to lower costs, because you have, people with better outcomes, shorter stays, fewer readmissions, and probably most importantly, you have people who don't have things done that should be done. I don't know if you realize this, but about 20% of pathology reviews, second opinion pathology reviews, reveal a different diagnosis than the first opinion. What we're hoping to do is bring more quality on behalf of the individual patient, but that is going to drive lower costs in the aggregate. That's what we all realize we need.
All right. Thank you so much for joining us today, Miles, and we really appreciate it. To everyone out there, have a very nice Memorial Day weekend, and until next week, this is HealthCare Consumerism Radio signing off. Thanks.